Welcome to the place where brains collide with science, wit, and a nerdy vibe. I'm Dr. Angel. Let's dive in where psychology meets a clever spin. Stay curious, be kind, and keep your mind nerdy.
Kids and teens, the wild, complex world of diagnosis and treatment. Hi there, fellow nerds. Welcome back to Nerdy Psychology, where we break down complex mental health topics with a splash of fun and, well, a little bit of quirky. May is Mental Health Awareness Month, and today we're diving into a topic that's both fascinating and challenging. Kids, teens, and mental health, and the confusing world of diagnosis. Diagnosing children and adolescents is like playing a game of psychological Jenga. One wrong move and it all comes crashing down. So let's break down how we approach mental health for kids and teens and why it's way more complex than it seems. Before we get started, if you're new here, welcome or welcome back, and hit that subscribe button to come join our nerdy, curious community. If you want to be notified when a new episode drops, hit the bell icon so you can have that notification. So, when we talk about kids and mental health, it's like dealing with a Rubik's Cube. Lots of moving parts and figuring out which piece goes where. Well, it's not always obvious. So, what do you do when your child's acting out or when your teen is withdrawing from their friends? Is it just a phase or is it something more serious? Today, we're going to talk about the complexities of diagnosing and treating kids and why a one size fits all approach just doesn't cut it. Why diagnosing kids is tricky. Diagnosing kids and teens can be so challenging due to their constant and rapid changes in their emotional and their cognitive and their physical development. It's unlike adults, children express themselves primarily through behaviors, which are not always, the good ones. This makes it so difficult to distinguish between what's typical in a developmental phase and a potential mental health problem or issue. One of the key factors contributing to this difficulty is the ongoing development of the brain. The prefrontal cortex, that higher order functioning part of our brain that's responsible for all those great advanced functions such as, emotional regulation and understanding cause and effect and, problem solving. It is literally the last part of our brain to mature. In fact, it doesn't fully mature until someone's in their 20s, early to mid 20s. So that means behaviors that might seem like anxiety in a 5-year-old could simply be part of their normal development. Similarly, what appears to be typical teenage rebellion actually might be indicative of a deeper issue like depression or ADHD. So the language of children's behaviors is complex. It is so often misunderstood. I can tell you, I have heard so many times in the counseling room of, oh, they know what they're doing. They know what they're acting like. They know this is not allowed. And instead of listening to the messages that our children are trying to tell us and our teens are trying to tell us. And I get it as a parent when you're in the middle of it and you're trying to do life and work and clean and cook and get the sports practices and all the things that happen. Having a child that has misbehaviors can feel like a very big inconvenience and very overwhelming. And so it is easier sometimes to just feel like they should just get this together. And sometimes they do need to get it together. And sometimes it's a lot, there's something more serious under that surface. For instance, a child who is acting out, they might be struggling with anxiety or stress, but their behavior could be totally misinterpreted as, defiance or disobedience. This misinterpretation can lead to not only incorrect or no diagnosis and ineffective interventions. If we have a child who's anxious and he keeps getting punished for or having negative consequences for the acting out behaviors, what we're doing is going to be growing that anxiety, because anxiety is based in fear. And so behaviors is the language that children tell us everything they're trying to say. And even our teens, like, they talk through their behaviors, and they don't always have an awareness of what they're thinking, what they're feeling, or the why, which, as a parent, I hear that a lot of parents will go, "Why are you doing this?" Like, most adults don't know why they're doing something. Trust me, children don't know the why either. And so it's really important that when we're starting to see these things happen, that we're paying attention to what is duration, how often is this happening, and does anything seem to help? So it's really important to consider those environmental factors that influence your child's behavior. So what are the family dynamics? What are the school environment? What is the social interaction? Every one of these things plays such a significant part of a child's social and emotional and cognitive and physical and development. And a supportive, understanding environment, well, that can just help mitigate some of those challenges associated with, well, some of those mental health issues for children and teens. So, what am I saying here? Diagnosing is so multifaceted. It requires such a holistic and deep understanding of the whole child and their whole world, not just what's happening in the moment. Behaviors and environmental influences, what's happening in the family, what religion or faith is the family a part of, what are the cultural dynamics, what type of school do they go in, what kind of relationships do they have, how do they get along with others, are there environments that they like, are there environments that they tend to struggle in more. Like, it is literally painting a holistic approach of this child so that we can really understand what's happening here. Because to treat something as defiance when it's depression will not be helpful. In fact, will make a child feel more depressed. But also on the reverse, to have a child who's acting defiant, but we think it's depression, and it may not be helpful either. And so that's the important part of looking at it. So it's really crucial that when we are approaching this process, first of all, there is patience. It is the number one thing when working with kids. I can't tell you the number of times parents just like scoot the child in my room. Some parents don't even want to come in for the intake. And how can I know what's happening in that child's world if you're not coming in to help me know what's happening from your perspective in that child's world? And they'll say, "Okay, Dr. Angel, just fix my kid." And they go and they want to come back. And then, like, 3 weeks later, like, "Oh, it's not better." No, no, that's not how this works. And so, patience, empathy, and a willingness to just look into and beyond the surface of things. And it's really a whole family system when we have a child who's needing some mental health evaluations. Okay, I'm going to give you an example. Let's say you have a 10-year-old who's acting out in school. She is throwing tantrums. She's having trouble focusing. She's avoiding social situations. She's not doing her homework. Well, sounds like kind of some classic ADHD symptoms, right? Hmm. Well, maybe not so. Kids are still figuring out how to express themselves. So, what we might be seeing, and you look at a checklist of ADHD symptoms, this could be just checking some of those check boxes. And I can't tell you the number of people come in with a form they found online. Look, my kid has this. Here's all the check boxes. But that's not how we look at that behavior and what's happening. And so they may be struggling with emotions, they may have a learning difficulty or struggle, they may be gifted and struggle. Sometimes we see our gifted kids really start acting out in behaviors because they're bored or they're not stimulated enough. And so what is happening? Is this child going through a developmental phase, a growth spurt? Are they overwhelmed? Are things happening in their home life or with their friends, or what's going on around them? It's really like trying to figure out the best path through this maze of possibilities. So, diagnosing children is not about just identifying the symptoms. This is why context is so vital. Mental health symptoms in kids overlap. So you could see a child who exhibits signs of both anxiety and depression. And the tricky part is figuring out which one came first or how to treat them in the right way. The overlap symptoms of kids and teens makes diagnosing one of the most difficult parts for kids and teens. Now, let's talk about the symptoms that often overlap for both children and teens. One of those biggest challenges is diagnosing is that so many mental health conditions share the same family or similar family of symptoms, and especially in younger children. So the younger a child is, the more the symptoms overlap completely. And so here are some of those common overlapping symptoms, but it's not a complete and exhaustive list. So, and attention. So this could be a symptom of ADHD, anxiety, depression, PTSD, a learning disorder, a child who's gifted. This could be a sign of a child might have trouble focusing because they're worried or stressed out, or maybe because they're bored and not stimulated enough, or maybe they're just distracted and they're creative and that's part of their personality and it's an immaturity. Irritability. This can be seen in children with depression, anxiety, fear, PTSD, changes in life, changes in family structure, a new sibling coming home, moving up grades. Like irritability can be a big one. Irritability in teens is also can be a sign of mood swings related to hormones, or it could be something related to their mental health. Social withdrawal. This is a common one in children and teens that may have depression, they may have anxiety, they could have PTSD, or maybe they're feeling shy or they're growing some social anxiety, or maybe they're starting to become more of an introvert, or maybe they just aren't in a space where they feel safe emotionally. Maybe they're getting made fun of or bullied, or maybe they're a little different. So these things, the social isolation, it can mean so much. The next one is trouble sleeping, and sleep disturbances. Well, here we go with the same laundry list, right? It can be associated with almost any mental health diagnosis, especially in children. But specifically, your anxieties, your depression, your PTSD can be associated with a lot. So, um, when we are looking at those sleep disturbances, we need to look at, well, do we have good sleep patterns in our house? Did we just not make good sleep habits? Or maybe my child's going through a developmental stage. Maybe my child's sneaking and staying up later than they should be. Maybe they have distractions like their phone or tablets or TV. Or maybe they're not sleeping because they're laying and worried and sitting in chronic panic or anxiety all night long. And so again, we have to pull that whole paint that whole picture of that child. And then mood swings. Mood swings could be a symptom of bipolar disorder, depression, typical teenage hormone changes, even physical conditions like hormone imbalances. So, in fact, I once had a teen who was diagnosed with bipolar disorder due to mood swings. And when the mental health medications didn't work, his parents were exhausted. They didn't know what to do. And so, well, to make a really long journey short, he didn't have bipolar at all. He had a very severe hormone imbalance. And with the use of an endocrinologist and the correct hormones, the mood swings became stable and they were gone. And so it's really important to keep our open mind and make sure that when we are looking at our kids that we're not seeing them through this one lens, this one box, because we are so overconnected. And diagnosing adults is complex. You can times that by like 100 when we're talking about kids. So another big one we'll see with our kids are physical complaints. So things like, oh, my head, my back, my tummy, I'm nauseous, I'm constipated, I achy. Like those are frequent symptoms, and those can be depression, anxiety, can be all kinds of mental health stuff. It can be a phobia, it could be a fear. And so it's really crucial that we do that full evaluation to look at a kid. And I'm going to say that over and over because I can't tell you the number of times I have a parent come in and they read a book and they're like, this is my kid, this is their diagnosis. or they've watched something on social media, or they heard an article or a story on the news and they saw a kid that was similar and that was their diagnosis, so this is my kid's struggle. And I like that you're looking at it, and that's important too, to be kind of conscious and aware of things, but it doesn't work that way. And so sometimes when I'm having that conversation of, well, first of all, this, we need to look and see what we're really seeing, and maybe that what really is happening isn't anything that they thought it would be. A lot of times parents can become very defensive or dismissive in that. And so it's really important that we allow that evaluation process to occur, so that we can make sure that your kid's receiving help that he or she does need, and is not receiving help that they don't need, or that would be harmful or could set them back. A misdiagnosis in kids can send them down the wrong treatment path. And it can be a stigma that they carry for the rest of their life. And so it's really important that we are taking our diagnosis and we are taking our evaluations and we're taking what's happening very, very seriously with our children. So, wrapping this back through, the importance here is a holistic approach. So, how do we get to the bottom of overlapping the development dilemma of children developing and the brain not being developed? How do we get through the bottom of all this? How does this work? Well, the key is really that holistic approach to mental health care, and not just focusing on the symptoms, but understanding what else is happening with your kid and with your child, and looking at what's going good. What are your kids' strengths? I tell you, a lot of times I ask my parents in the intake, what are your child's strengths? And a lot of parents really struggle to find positive strengths in their child. And that tells me that they focused really, the big focus has been on the behaviors or what's causing the most stress in the home. And so we can't just see our kid or our teen through the lens of the behaviors or the disruptions. We need to see them through their whole personhood. They're not just doing this to make you mad or to ruin your day. And I say that because I have parents who tell me they're just doing this to ruin my day, or they're doing this on purpose, or they knew I wanted to do something and now they ruined it for me. Instead of listening to those behaviors or getting the professional help to help you learn how to listen to those behaviors. So holistic approach, just it's looking at the whole, looking at the child as a whole. We're not taking compartments, we're not just taking symptoms, we're looking at all of it around. I also want to add that family dynamics play a crucial role in a child's mental health. The relationships and interactions within the family can significantly impact a child's emotional well-being. For example, a supportive and nurturing family, well, that might help mitigate stress and anxiety, while a chaotic or conflict ridden home, or a child who's constantly being bullied by a sibling, that can make mental health issues worse. It's essential to involve the whole family when we're working and treating children. So when your child's profession wants you to get involved with it, please don't hesitate to get involved. And if they're not asking you to be involved, you need to ask to be involved, because it is really about wrapping that comprehensive care and support. Remember, a child's whole environment is really in the control of their caregivers or parents or whoever those responsible adults are, and they don't have agency and autonomy that we have as an adult. And so it's important that it's a team work around that child, because we can give children tools and help them mitigate some of those things, but if the family dynamic is in such a way that is not helpful or it's chaotic, we're just going to be playing whack-a-mole, and it's not going to ever really make healthy progression. And so making sure that we're really taking in account the developmental stage of the child. And think about, like, children, like, they grow, and there's these parts of development where there's huge growth spurts happen, like socially or emotionally or physically, and maturing. And so each one of those places, those targets in their timeline, those milestones, have a whole unique set of challenges that come with it. well, that also happens in the scope of what we will see in our child's behaviors and our children's language and what's going on. So the more you can understand just development and healthy development and some flags in development, the better equipped you're going to be able to say, I see a concern, and bring it to the professional. And so by doing a comprehensive assessment and getting our children those questions to the professionals, and if you start with a pediatrician, that's a great place. Pediatricians can have developmental checklists. They're a great place to open some of those conversations of, I'm feeling concerned about this with my child, and we go to the pediatrician, on certain continuum, or setting an appointment for a mental health professional, because maybe you're not sure, and maybe it isn't something, but maybe that family or that child could benefit from some tools in therapy or communication. Maybe it's a breakdown in that. And so by doing a comprehensive assessment and accurately diagnosing, we can have effective interventions, ultimately helping the kids, the teens, with way better mental health outcomes, helping that family have more peace and to function in a healthy way and be able to be supportive and not overwhelmed and overstressed. Because anytime there is one child in a house that's struggling and having behaviors or moods or isolating, it impacts the entire family unit, and it puts stress on all the other people. I've had a case one time where I was a family of multiple siblings, and one of the kids really, really struggled. They were acting out tantrums. And the family couldn't do outings. They couldn't go do any of the things that their other friends' families could do. They couldn't go to birthday parties because the kids' behaviors they'd have to leave, and it was embarrassing. And these kids really grew to resent their sibling because they felt like they missed out on their entire childhood because they always had to leave because of this child who never got diagnosed, never got mental health help as a child. And so now as an adult, these siblings have a really broken and resentful relationship toward each other. And that young child had a significant mental health diagnosis that they still have as an adult today that went untreated. And now they don't have the family for that support that they could really use in their healing journey, because so much damage happened in childhood that it is going unhealed right now. And so I'm hoping that this family can wrap it around, but sometimes they can and sometimes they can't. All right, folks, that's a wrap. If you like this episode, hit that subscribe button, give us a thumbs up, and let us know in the comments what you. Stay curious, be kind, and keep your mind nerdy. That's a wrap. See you next week.
Stay curious, be kind, and keep your mind nerdy.